efforts that are happening globally. There's too many to mention. We're going to hear some of them on this panel. And also in Zimbabwe, there's a WhatsApp group that students and USAP alumni formed that takes information from the Ministry of Health that they publish, and they spread it across WhatsApp to counter some of the misinformation that we get on WhatsApp. So that's a really good, positive use of WhatsApp and information broadcasting, I believe. So, by the way, my name is Tichakunda Mangono. I go by Tich. I work for the Sego Foundation, where we use machine learning and behavioral science to address social issues, particularly public health is my specialty. I've worked in the African region for quite a while. So why are we here? Our objective, as you probably know, as you've seen from the website, is to bring together experts from the medical field, the public health and technology field, who have a vested interest in Africa, and particularly in Southern Africa and Zimbabwe, so that we can all jointly develop solutions for the region, particularly when it comes to COVID-19 and looking at the rising cases that are in the Southern African countries right now. So the main question is, how do we get ahead of the virus in spite of the context of low resources, low technological settings in terms of the resources available, but also in terms of the economies and what we face in general. I will walk you through some of the agenda items that we have today. But one thing to really focus on is that we want an output out of this meeting. We have so many brains in this Zoom webinar, in this Zoom room. Some of them are in front of you as panelists. Some of them are in the audience as well. So we want to get all of that information once we set the process and get the ball rolling on what is happening with COVID in Zimbabwe, in Southern Africa right now, to come up with some recommendations that we can then share either with the Ministry of Health, with different stakeholders. We all represent people who are very interested in finding out what we can do for COVID before things get worse. So in order to help us get there, I'm also joined by a panel of esteemed guests and panelists. We have 4 health practitioners, healthcare practitioner panel, which is a really good mix of people and their expertise. We have Dr. Sacrifice M. Chirisa, who is right now the Deputy Director of Mental Health, Minister of Health and Childcare. Dr. Chirisa is a top psychiatrist, mental health champion, and a recent COVID survivor. So we'll be getting some of his insights on what is the direction on mental health in Zimbabwe with relation to COVID, as well as what has it been like to survive COVID. We also have Constancia Koni Mawodza. She is a process evaluation lead at Biomedical Research Institution in Harare, and she particularly focuses on health programming policy. Next, we have Nancy Kasoshe, who is a customer engagement manager in corporate healthcare. Nancy's competencies are strategic thought, leadership, innovation, and innovating on how people access and experience healthcare. She's founded several ventures, which she'll probably talk about in relation to this webinar. Then we have Fibion Mangwedeza, who's Senior Program Manager at CHAI. Fibion is a veteran of diagnostics and healthcare access in Southern Africa, but also in Zimbabwe. He is playing a particular role in terms of COVID. And he will tell us what has been happening with COVID in Zimbabwe right now, and also a little bit about the situation in Southern Africa. Then for forthcoming discussions, we also have discussion leads, Itai Mujingi, who is a biomedical research expert and currently an intern with Roche. So he knows a lot. He's also a Rose Scholar 2018. He's passionate about how can we mobilize grassroots to work on public health. Then we have Clarity Kaseke, who is a research associate at Dragon Institute. She is particularly working on vaccines and vaccine research at MGH, MIT, and Harvard. Then we have Glenn Pani, who is very experienced in policy and governance issues. He's based out of South Africa. He focuses on issues in the region. And he is a founding partner at Sparks, managing partner at Sparks, which works on human rights and advocacy and social issues. So as you can see, we have quite a lot covered in terms of what we're going to discuss today. So without further ado, we're going to go into talking about what does the agenda look like. We are going to start by the introduction that I just did. Then we're going to go into a conversation with the expert panels. We're going to start with Dr. Chirisa, and we're going to also go to Fibion. And then we have a question and answer session. And then we go into the next expert panel, which will focus on role of private sector, impact on research and social policy and governance. Then we're also going to get into breakout rooms. I think we're still working on our technology there. If we do not have the technology for breakout rooms, we might get into specific questions. We'll get a third panel focusing on vaccines, social impact of COVID-19, as well as grassroots efforts that we can all come up with and get recommendations towards the end. And after the breakout rooms, we're going to have a report out and then discuss what our recommendations are going to be and how we think we can disseminate some of this information. Because I'm really hoping that we can get to some very innovative solutions, especially because we have multiple people across different sectors, across different regions, right? And people who are thinking about this from multiple angles. So before we get into the panel's discussion, I wanted to just quickly give us a reality check, right? So just this Monday, August 12th, right, we saw that globally in the world right now, we just passed 20 million cases. So all the countries reporting shows us that the world is now at 20 million cases. At the same time, unfortunately, Africa as a whole has also hit the 1 million mark, right? So that means there are about 1 million people who have been tested and recorded as cases, as COVID cases. And as you can see here, even though up in Africa as well, the colors look a little lighter. So the darker the colors are, the more intense or the higher the cases of COVID in that country. You can see that the African continent is a little light, except for South Africa down here. And part of that is because some of the reasons for COVID spread include population density and also include how people are moving around each other. And one of those is major capital cities are usually the first ones to get hit. And that has been the situation in many countries. So what then happens though is some of the work that we did at SECO Foundation shows that the COVID cases then tend to move into more vulnerable areas. So you might think that your rural areas are seeing fewer cases now, but in the future, once COVID spreads, they are actually the ones that are most vulnerable and least likely to be able to weather the impact of COVID. And it speaks to some of the work that we've been doing at SECO Foundation as well. One of the things to note as well is that these are only recorded cases. There might actually be more cases. In fact, there probably are. Some research that we've done and that other people have done around this show that we could be undercounting by a factor of even 9 to 10 times actual cases that are going on in different countries. So there's no time for us to basically waste, right? So without further ado, I will turn to our panelists, and we're going to start our conversation with Dr. S.M. Chirisa. So as I mentioned, Dr. S.M. Chirisa is leading is Deputy Director of the Department of Mental Health in the Ministry of Health and Childcare. And he also happens to be a COVID-19 survivor. So he's coming at this from many different angles. And I've seen some of his information and how he's sort of he's fighting stigma as someone at his level. So Dr. Chirisa, can you tell us a little bit more about one, your experience with COVID-19 as a survivor from that angle, and what it has led you to realize, or how it has informed your work as the Deputy Director of Mental Health, and also what should Zimbabwe look out for in terms of mental health? What should we be thinking about during this crisis?
Thank you. I think my experience as a COVID patient was really an eye-opener. I suffered as a COVID patient in July. I was probably in the moderate range. I actually had a part of my lung collapsing, and it took me almost 2 weeks of serious illness and then recover. In fact, during that time, I even ended up writing my own will because I thought this was the end. I really was very ill. But what I realized is, the mental health aspect, the lack of psychosocial support, that is key. Because when one is suffering with COVID, there's a lot of anxiety, a lot of fear, a lot of worry, and a person is definitely subjected to a lot of psychological trauma, even during and after. And afterwards, obviously, the reason why I then came out was that there was a lot of stigma which was going on, even in our country, right? At the moment, I was expecting that by now we should be having an avalanche of people coming out but they're still very thin or very few people that have actually come out. Yet there are many cases of prominent people, singers, politicians, people in authority who could have actually done a good job, but people are still holding back. And the stigma is so real. When I went back to work, I had to literally go with my negative result and show everybody, because people would not believe that you are now negative without us actually seeing the result. And but obviously, with time, people then start to interact with you with more calmly. But at first, when I went back to work, a lot of distance, a lot of people were not very comfortable with me even walking through the corridors. They said, "Are you already ready? Should you continue to stay at home?" They were willing to give me all the days to recover, not because I've not recovered, but because of fear. So what I have seen and come to realize is that we are not prepared of the psychological effects. And I'm speculating that there's going to be an avalanche. There's going to be a growth of psychological issues which are going to come during and even after COVID has gone. And we need to actually prepare for that pandemic. And that's what we are doing in the Ministry of Health right now. We are really preparing how we can tackle the psychosocial effect and how we can provide that service. Thank you.
Thank you very much, Dr. Chirisa. That's a very powerful. I remember when I saw your video online at the Ministry of Health website, it was a very powerful moment to see that we have some people who are in the prominent space talking about COVID and making destigmatizing it. That's not something that usually happens. You can think about even when HIV started. We need to think ahead of some of these stigma issues and quickly come through to them. You mentioned the Ministry of Health is working on a couple of different initiatives around how to prepare for it. Do we feel that we are well-resourced enough? What are some of those issues that you're focusing on within the mental health department, and what are some of your challenges and pain points?
Now, the main thing is that we are resource thin in terms of financial resources, number one. Number two, we also don't have the human resources. For example, we've got about 15 practicing psychiatrists for a nation or a population of 15 to 16 million. We've got, maybe about 50 psychologists for the whole nation, clinical psychologists. So our strategy was, look, given the extent of the need and the people that are specialized in that area, it is impossible to provide any decent dent into the space that's needed. So we had to change strategy. So our strategy now is using what we call task shifting. We are actually training non-specialized people to provide, for example, we have chosen an instrument called psychological first aid, and we are now training psychological first aid to lay people, non-specialist people, to nurses, doctors, pastors, and our aim is to train 2,000 so that we're able to spread them throughout the whole provinces, because of the numbers that we expect to increase. So we are training them how to handle the anxiety, depression, and even death issues, and how they can help people to go back to work, and the expected even aftermath for those who survive. They'll continue to have sleep issues, stigma issues, anxiety issues. So we are now task shifting to non-specialized cadres so as to increase the service provision of psychological services.
Right. No, thank you very much for that. I think this is very interesting and very important as well to have the Ministry of Health and government leading this. And but I think as government works on this as well, I think you mentioned very aptly that we are, the government is low resourced, and we are trying to find ways to go around that. And that's really the purpose of this webinar, to say, in this low resource situation, what can we do as the government? But also there's support, a lot of support that comes from other partners, stakeholders within the country. And one such organization is Clinton Health Access Initiative, which Fabian works for as Senior Program Manager. I know he's worked on a number of different projects, but right now he's also very well versed on what's going on in terms of support for the government and how other organizations are supporting the government in this space. Fabian, can you tell us a little bit more about what have you seen as the primary and secondary effects of COVID-19 on the healthcare system on patients, on practitioners, and also what do you think are sort of some of the big successes, but also some of the big gaps that we still need to fill? Oh, you might want to go on unmute.
Thank you, Tish. Sorry about that. So I come from an HIV and TB background, and I think like everybody else, nobody was really prepared for for the pandemic to hit. But what we have seen, I think, is that all the lessons that we have learned from dealing with HIV and TB and malaria are some of the some of those lessons can still be applied to COVID, and this is where we have really been, supporting the ministry in doing alongside other partners like CDC, UNICEF, and all that. So I think key three areas where we've been working on was to sort of like plan best scenarios for dealing with COVID. Just like HIV, everything has to be tailor-made for a particular community. Like you mentioned earlier on, certain areas are hit first, and then it goes to other areas. So how do we plan for all this? And I think the other area has been, Dr. Chirisa mentioned about HR capacity. Like what we have right now is all we have to react to all the various health issues. So we have been, working around creating extra SAGE capacity, to deal with COVID from what we already have. How do we train, the people that are already working on HIV, who are working on TB, who are working on malaria, to come in and assist with that. Obviously, that means people have to work 110, 120%, so that other health systems do not fall. And then I think one area where I've been mostly involved in, I think, is on the technology side for testing for COVID. And what we have been doing is to say, funding is not available, but we do have a lot of other, health technologies available in the country. How do we use those to be able to test for COVID, to make sure that even people in the low-lying areas still get access to testing? So those are the three key areas that we've been working on. But maybe just to speak, to your other question on what has been working, I think we were fortunate, especially on the testing side, that the better part of 2019, we really worked on what is called diagnostic network optimization. And what this looked at was to sort of map the whole country. What is the HIV, TB, and malaria pandemic like in the country? Where do we have technologies, and what can we use, which is on the ground without further capital investment? And with COVID coming in, we already had that information. We were able to quickly react to the testing needs. And I think that's even going forward, something that we look forward to make sure that I think that part is quickly strengthened. Thank you. Over to you.
Thank you very much, Fabian. That's a very, very good description. This is really good to know. So some of the gaps that we can look at, but also some of the successes in terms of what is working. I think it's very interesting you bring up testing. And I think testing is always an issue that people talk about when it comes to COVID-19. And I know a lot of people are obviously, one of the biggest questions that people are asking is that, is there enough testing? Now we are seeing 1 million cases, but are we seeing the iceberg effect where you're just seeing the top part of the infections, and then there's this whole big bulge of iceberg below that you might not be getting, that we're not testing, especially with asymptomatic people and so on. Can you speak a little bit to that? I think that's been a question that has come up on many people's minds recently.
Yeah, so I think speaking to that, I think, to be frank, we are not doing enough testing. I think we are about 3-4 months into the pandemic, and the first steps were really, reactionary and trying to stop the quick spread. So we have an HIV testing strategy. We had one, for the first 3 months of the pandemic, which we are reviewing right now. So I think the initial part was to try and, contain the situation. Make sure that anybody who's coming into the country is tested, and all their contacts. And obviously, we didn't have enough commodities in the country. I think, a lot of, the suppliers were still trying to also make products for that. So testing was very limited, to, high risk areas, people that were coming into the country, returning residents, our ports of entry. But then for the next strategy, we are obviously moving, towards broader testing. Like you're seeing right now, there is no more community transmission versus, cases that were being brought into the country. So now we have to go into the community. So that is going to require much more resources, than what we used in the beginning, where if, a certain location is identified as a hotspot area, then you have to test everyone there. And this is the next stage, which is going to be, resource intensive. We have been doing PCR testing, for some of the cases, but looking at, the amount of time it takes you to test, using that test, and the amount of human resources required, as well as, the financial resources, there is no way you can be able to test, large numbers using that. So we are now looking at alternative tests, like antigen tests, which are rapid tests, which were like a big hit for HIV as well, where you go to low cost technologies, which you can use for a bigger population. As you know, like we have one of the biggest ports of entry in Southern Africa, which is our Beitbridge port of entry, where we have a lot of truck drivers who come from, South Africa, coming to Mozambique, going to Mozambique, Zambia, Tanzania, all the way up into Africa. So that's another area which has also been identified as a high risk area, and we need to be screening in those areas where we see about 500 truck drivers in a day. So obviously testing strategy has to change, and this is something that we are working on as the epidemic changes as well. We have to be dynamic in doing so. And we've been working with, CDC Africa. We've been working with WHO to see how we can bring in commodities, how we can also support some of these strategies as we sort of scale up testing in Zimbabwe. And this is not only like an isolated effort. We are also working with other countries, because obviously if someone moves from Zimbabwe to South Africa, they can transmit there. So it has to be a concerted effort across all these different countries. Over to you.
Thank you very much, Fabian. Clearly, you've been working on this for a long time. It's really good to hear a very clear and concise description of what we're doing and what the gaps are. And so this is our first session. As you know, we talked to Dr. Chiresa. He told us what's happening in the mental health department, his experience as a COVID survivor as well. And we just heard from Fabian about how other organizations, an example, are supporting the Ministry of Health. I want to just move it back to, so we have a Q&A session now. And if you have a question, just type it in the chat. We should be able to enable the chat. We are not going to be able to get to all the questions. If we see other questions, I think every question is important. So we'll document them and then maybe have them answered later. So we'll probably have space for only a few questions right now. But I wanted to go back to both Dr. Chiresa and Fabian on this session that we're just talking about government and government supportive work. How do you feel your focus as organizations has been maintained or scattered, right, based on the COVID work? And what has been the impact on HIV, malaria, TB? A lot of people are really worried about some of those secondary effects, that when you can't get drugs to people, you can't get your monthly prescriptions and things like that. So any of you can take that. Maybe we can start with Dr. Chiresa. What has been from inside the Ministry of Health? Do you feel that the focus is still, are you able to still focus on other issues, or is there a need for more resources on that end?
Thank you. Definitely the emergence of COVID-19 really disturbed, most medical programs, especially the provision of essential medical services. We have seen major disruptions in major tertiary and secondary facilities. And obviously, we then had to come and actually put up a committee and then looked at re-establishing, essential services in view of COVID. Because when COVID hit, everybody then shut down because of fear. But now we are so most services have been greatly affected. I think maybe Fabian will be able to tackle what the HIV and malaria has done. But all those services, we know it definitely the central government, they have been affected, and we are actually putting committing and strategies now to try to reestablish them and make them work. But it has been a feat in itself. Over to you.
Yeah, so maybe just to add to that, so in the first weeks of July, the Ministry of Health, with support from CHAI and WHO, actually did an assessment of the impact of COVID on HIV, TB, and malaria programs, and the report was just released, I think, last week, and it's quite clear that I think these programs have taken quite a big hit. Some of the systems that had to be put in place to try and combat COVID, like the lockdown, obviously had impact on patients, access to healthcare. They could not easily travel, to go to some of those places. Obviously, financial, constraints came in. A lot of money had to be diverted from other programs. So, the reason why I think we were active in this particular assessment is because I think the country and several partners have invested a lot in HIV and TB programs, and we run the risk of really, going back on those gains. We could lose more people to HIV and TB than we would lose to COVID at the end of the day. So I think everyone is now readjusting and re-engaging to make sure that I think we do move forward and go back and not forget, our HIV, our TB patients, but also globally, like right now, it's very difficult to get flights into the country, cargo flights. So there've been supply chain, issues that are outside, sometimes the government's control, where you can't bring in certain commodities from where they were scheduled to be coming from. So I think the impacts are widespread, but the assessment that we did, really helped pinpoint some of the bottlenecks, and then we can actually then come up with interventions that are targeted at those bottlenecks that have appeared now because of the COVID pandemic. Over to you.
Right. That's very powerful. We could lose more people to HIV and TB than we do to COVID in the end. I think that's a good reality check and a good prioritization check for us to be able to remember that we are working with a system. It's not just a pipeline for addressing COVID issues. So now we want this panel to be very participatory. So I'm trying to see if there are any questions in the chat, live questions. These are some of the questions that we've found. Let me see if are there any hands raised. So as our technology expert is figuring out who has their hands raised and how we can maybe get them to the chat.
Yeah, there's a question from Fortunate there. She's got her hand raised. So Fortunate, I'll go ahead and unmute you really quickly and we'll let you talk. 1 second here, and I will find you. Okay. Okay, unmute.
Okay, can I go ahead?
Go ahead, Fortunate.
Okay, thank you so much for your insights to everyone who's on the panel. My question is directed to Dr. Sharisa, who spoke about mental health services in Zimbabwe. I have a question about what the ministry is doing to sort of start normalizing the conversation about mental health services and just mental health in general, not specifically just related to COVID-19, but making it part of everyday conversations. Are you thinking about doing collaborations with like other ministries, like the Ministry of Health or of Education, for example, to start teaching kids the importance of mental health starting from school as a starting point, for example? Because I know for a fact I wasn't taught that in school until I came to the US. Then I started learning about mental health and things like that. But are there any such initiatives that are in the pipeline for as sort of like preventative measures to just start talking about mental health before we have to do the Band-Aid effect, since we already don't have enough human resources to be going out and teaching or like even treating people with mental health issues? That was my question.
Shall I go ahead and answer?
Go ahead, Dr. Chirisa.
Okay, thank you. Thanks, Fortunate. That's a very pertinent question, and it's one of our issues that we are thriving to settle. What we have done is that in our strategic document, which is running for the next 5 years to improve access to mental health care, what we have seen is that in the past, mental health was practically ignored. The department, even at the Ministry of Health, was practically small, not robust, ill-equipped, with very few. It's practically neglected, with a very negligible budget, even in the getting the smallest budget for health. But now we have made so much noise. Just like you, I also got taught of psychiatry when I was in medical school. But I then, experienced a lot of losses. I lost a lot of my friends when we were in medical school. One shot himself with a shotgun. One died from an overdose, and it gave us a wake-up call that there's something wrong, and people, we do not know what is happening. So what we are now doing, that we have made a lot of noise. We are doing a lot of awareness within the ministry itself, and what we are now seeing is that mental health is now starting to get attention. It's also starting to get funding, even funding from partners. For example, this year we actually won one of the first biggest funds in mental health, called the U Initiative. And in that U Initiative, we are currently doing some consultative buy-ins, as we look and say, what can we use these funds for? In the area that you have spoken about, to put this and to involve other sectors. The Ministry of Education, the Ministry of Social Welfare is one of the things that has come to the fore, and it will be actually funded. So there's a lot of good, really, as there's really now a focus on mental health. I think everybody, including the ministry, has seen the need of psychosocial and mental health, and so we are now seeing funds being streamed to it, and we are also building the capacity. We are getting technical support within the ministry, so that programs and activities can actually be done and have good outcomes. Thank you.
That's a very good one. You have to make noise to get noticed, especially for programs that have been historically underrepresented and maybe even stigmatized, even in community, in the communities that we grow up in. So I wanted to see if we could take one more question from the audience. I think there's some questions. Are there any other questions that are pending?
Yeah, so there's a comment here from Simba Movambui, and he says COVID-19 did deal a terrible blow on the Zimbabwe healthcare system, and we also need to be cognizant of the fact that the whole system was already ailing. We've had job actions every other month, and presently nurses are mostly on strike. And then as a follow-up to that, there was a question here from Tatenda Yemeke that says, is the report on the impact of COVID-19 on HIV, TB, and malaria programs mentioned by Nyarazi publicly available? If so, where? And before that response comes, I just wanted to say I am noticing the other questions. We have a question from Angela and then another one from Edward, but I don't want to get ahead of the panelists because I know that's coming, and we can ask those questions as follow up to what the rest of the panelists talk about in the next segment.
Right. Yeah. Thank you for that. So I guess that's for you, Dr. Chirisa. As far as you know, I think this is more sort of talking about the human resource issue and also sort of the inherent challenges we have in our system, right? Anything you can say about that?
I think I can speak about that. Over the past 6 years, I was in the executive of the Zimbabwe Medical Association, and I just resigned last month as the Zimbabwe Medical Association Secretary General. And it has been something that we have been seeing, the perennial strikes, and which then increased in frequency. And it's like good doctors go on strike, they come back, nurses go on strike, they come back, and we are still dealing with the same issue. And so obviously the HR issue is one of the biggest issues that has affected the COVID response. And we are not quite sure how that is going to be solved, because it's a financial issue, and what is needed is finance. And the capacity to pay at the moment is being said that it's not there. And so it's so difficult because now people are suffering, and the private sector is also ill-equipped, even though they're trying to, and they are charging exorbitant prices. So when you look at the your vulnerable groups, your low income, your unemployed, who are the bulk, you definitely will suffer. But at the same time, so these are issues that have not been addressed over the past 10 years, and they've now really come home to really bite everybody. Those who could fly out before, those who had money to go to South Africa, to Dubai for treatment, now they can't. They have to be treated here, and the system is not robust. So I think the opportunity is that it has given everybody that we need to invest in our own health systems. We really need to take it seriously and make sure that we've got functional systems, because if these pandemics continue to come and there are lockdowns in the future, and we still have not learned the lesson that we need to build robust systems in our own country that will be able to save us when the world is under lockdown, then we are not learning. And so I'm hoping that this is a clear, loud message to everybody. So that's what we are also doing. We are, in my department, what we are doing is we are now really pushing for establishment of those systems, and pushing so that we are self-sufficient and we are able to react to any crisis. And right now we are really playing catch up, and we are still far.
Very well said. I will not add anything to that. I like the words that you used. It's an opportunity. We need to be self-sufficient. Even within this disaster, I think it comes back to our title of the webinar, which is within this disaster, what is the opportunity? It's really unearthing some of the things that already exist in our system. So we have an opportunity to address them. And I know you're well equipped to deal with that, from within, from where all the experts stand. So that's a very good questions from the audience here. So I think we'll carry on. Yeah,
can I add something on here?
Go ahead, yeah.
Just really quickly, thinking about mental health in Zimbabwe, or just from an African culture perspective, right? A big challenge, as you've talked about, is like the stigma around it, and how people never think that they need the help. So even just outside of COVID, Dr. Chirisa has talked about kind of the approaches that are coming from the government or institutionally, but they can also be grassroots approaches to this. And I'm sure Itai is going to give some more color to things like that. But I know, for instance, of a project called the Grandmothers Benches, right? It's in Zimbabwe, and it's actually in Zimbabwe. And basically they're training these grandmas to be able to sit on a public bench, and people come and talk to them about what's bothering them. It's such a very simple, beautiful project, and I think thinking more in general, just across the board, about homegrown solutions that are culturally relevant is one of the things we need to do, especially for topics like mental health that have context of stigma around them in our culture. And I think there's an opportunity for the ministry to support, projects like that. I don't know how far they've gone as yet. I know that they actually have been doing actual testing of the concept for a while, and I know some of the entrepreneurs involved with it. But yeah, homegrown solutions to contextualize issues like this. That's it.
That is good. Thank you. Thank you for adding on to that. I don't know, Dr. Teresa, I know you're probably very aware of this initiative. Anything you want to add there? I think this is a very good one that Nancy brought up.
Yes, yes, true. Well, it's called the Friendship Bench, which was a homegrown solution by one of my professors, Professor Chibanda. And I want to say that we have actually adopted the Friendship Bench as one of our strategies in our strategic document for mental health provision. And I can actually say that in this last week or two, we actually signed a memorandum with them for them to go into all the provinces as an approach to deal with mental health in the grassroots. So we have definitely supported, and we really love that approach, the Friendship Bench approach. Thank you.
Amazing. Thanks for sharing that update.
Yeah, no, and it's good to see these two worlds colliding, right? You have sort of the world where the government and policy and Ministry of Health and the organizations that are supporting the government and ministry and on public health. But then this is the new angle that we're actually moving on to. I think, Nancy, this is an area of your expertise. I know we've been discussing, I read one of your articles when you talked about, you participated in this MIT hackathon, just really focusing on how do we get creative in low-resource countries to be able to garner up the resources for entrepreneurship. What is the role of the private sector? I know you're in corporate health. Can you tell us a little bit more about your experience with trying to come up with ideas for COVID-19 in Africa, but also on a broader scale, what do you think is the role for private sector, being someone who works in corporate health?
Indeed. Thanks for that. So I can think of, well, I'm going to sort of answer this question with some examples of what I've already seen and experienced. So I think there is a broad role for private sectors. I particularly work in healthcare. So there's been a very specific role for us in developing kind of new solutions that can target COVID-19 on there, but also more broadly, just private sector across the board, right? I think we've seen it already happen in the US with companies like GE starting to, manufacture ventilators. Companies like the ones that do whiskey in Kentucky starting to manufacture hand soap and all these other things. So really thinking about how do we redirect capacity and resources and expertise towards COVID-19, and what can we do with things or companies that are like that in Southern Africa or in Zimbabwe. And I think on the comments there was a question from I think Angela Kumirai, and if I captured it right, it was something about like what can other professions outside of healthcare do. So that's where for me the MIT COVID-19 challenge was a very interesting space to be in. So you have this private institution that decided, now they're like actually on their 9th version of this hackathon, right? Where they consolidate all these resources of many different expertise from around the world to focus on one problem. And it was like 48 hours. And you have people like me coming from corporate healthcare, you had clinicians, you had students, you had so many different people. And then the one for Africa actually had like 50%, people coming from the African continent. So I saw MIT as an institution using its resources and its platform to actually be able to, help people devise new ideas and solutions for this. And I got to, so the version I participated in was about us coming up with ideas, but there was another version where there were already ideas and they wanted people to help those ideas like scale and grow. And for me, that's where I see other professions coming into play, right? People with business development and any other types of experiences applying themselves to COVID-19 solutions. Then another thing I would say about infrastructure and resources as well. An example is there is an NGO called Cola Life, which basically their idea was that Coca-Cola can be found everywhere around Africa. Why can't we find medicines in the same way? So they worked with taking the supply chain of Coca-Cola and using it to get, essential medicines for diarrhea to the last mile of different parts of Africa. They're based in Zambia, by the way. And that, again, is another way of taking the private sector capacity and resources and infrastructure and using it to drive COVID-19. My last point would be what was one of my takeaways from the MIT COVID-19 hackathon. There were some really great homegrown African solutions that came out of that hackathon. And what I saw though was that, so they didn't win. Most of the African homegrown solutions didn't win, right? And I don't know if they ever got support beyond that. But the challenges I saw were in really being on a world stage and being able to pitch and all these different skills that, people who are from Western countries or are educated there have much more experience in. And that's what I would like to see, if we can leverage institutions in Zimbabwe and professions to do that, right? Can something like that be organized by Cape Town University, for instance? And can we really apply ourselves differently with our different skills wherever you're coming from in the private sector to address COVID-19? That's it for now.
Thank you, Nancy. There are a lot of things you touched on, and that is very clear. One thing, I think your last point is very salient. One is, yes, I think we're working with private sector, we're working with global partners, but can we really realistically pitch grassroots efforts at that level and have them go through the same level? Does everyone have the context, right? Does everyone have, I think sometimes ideas might die a natural death, which doesn't necessarily reflect the quality of the idea, but just, some sort of, the platform is a little different, right? Right. There's an advantage to looking at things from the tech and the private sector side, but I think that is a really good recommendation of, can we get African institutions, local organizations to be at the lead of some of these hackathons? Because when you talk about, some of these solutions like the friendship bench that you just brought up, some of those ideas, right, it may not be necessarily obvious until you see them in action, you've seen the cultural context around them. So Indeed. That's very useful. Yeah. Indeed.
And I will add that my idea, the one that I actually came up with from the hackathon, we didn't win, but it was, again, that is very example of like, you understand the context, right? So we ended up pitching an idea of using religious, like churches, like infrastructure to drive education and also production of local PPE. And it was, I spent that whole 48 hours, I talked to pastors on the ground in Zimbabwe. Mrs. Mano was amazing at connecting me to those people, and just an idea of like, churches are not being used right now. How can we use that space to do that? And people trust religious leaders a lot. So how can we use them to transmit the correct information about COVID-19? And it didn't land. There were other ideas that won, but I was quickly reminded of that when you just mentioned that. And that's why I would like this to be done in Africa by Africans, because I think there's a lot of innovation and entrepreneurial energy that can be harnessed, not just in COVID-19, but always. Africans have always been solving our own problems, right, for the longest time. What has lacked always is access to platforms and infrastructure to scale those ideas.
Exactly. Enough said on that. I think we can come back to it. If any other panelists also have anything to add, we can go on. But I wanted to move quickly to hear a little bit more from a slightly different angle, which is the one that Constancia brings to the panel. So Constancia is a process evaluation analyst and a researcher in Harare. And Constancia, you and I, when we were talking about different conversations, one story that stuck out to me was one where you were going out to the field, doing research, making sure that people are getting the medicines that they need. And then you were stopped by police, I remember. And then you mentioned that, that actually kind of hampered or hindered the being able to sort of deliver services, right? What are some of the effects of, right, well-intentioned, some, you know, in terms of non-pharmaceutical interventions of lockdown, right, where everything just sort of like gets, you throw out the baby with the water, right? So you lock down everybody, and then even people who are bringing medicines to people might not get that chance. Can you tell us more like around that story? What has been the impact on research and the fieldwork that you are doing, and what do you think we can do to address some of those issues?
Sorry, thank you. My internet is a bit wonky, so if I get off video, forgive me. So I work in clinical trials, and we're doing a community-based intervention. I work with young people, 16 to 24 years old. We're offering HIV and sexual and reproductive health services to young people. And we had to shut down for 6 weeks at the beginning of the lockdown, which created a bit of a nightmare for our clients. So when we reopened in mid-May, we had everything from an increase in unintended pregnancies amongst our young people because we weren't there to offer family planning. We had an increase in STI infections because young people continued to have sex. That was just the fundamental. In week 1, I was talking to young people and they were telling me lockdown, and you can imagine 3-4 months of access HIV prevention commodities. So I think for us, from our angle, it's a lot of COVID-19 basically just brought to the forefront bigger issues that we have within our health system, right? So our ability to serve young people, our ability to think through how do we still continue to provide essential services even though we're still within this pandemic way through. And yeah, I don't know what our trial results will show, but we didn't have a lot of services. We provide menstrual health hygiene products, and all of this is for free. And for a good 6 weeks, young people were not able to do that. You know, we provide referrals for VMFC, and one of the providers we work with was telling me that, Connie, right now, if I give someone a referral for circumcision, they can't get on public transport. You're not allowed to travel, right? So it's a useless referral, really. If I refer you to PSZ because you want to get implants or a longer-term contraceptive, it's useless because you will not be allowed to pass a roadblock to go get the services that you need. So I think, as Fabian was saying earlier on, that a lot of the way we responded to COVID-19 early on was very reactionary. And I think right now we have an opportunity to start thinking through, well, now that we mostly know what we're into, how do we still ensure that other health services continue to function and continue to be delivered and available to the people who need them, whilst we're also in parallel figuring out what to do with COVID-19.
That is good. I get from what you just said, you know, life goes on, right? People continue to need the things that they need. You know, young people continue to do what young people are going to do, right? So that's a very good point. And you're actually bringing into focus a demographic that is very pivotal to the idea around COVID spread and infection, and which is young people, right? Young people are less likely to be able to affect it, to get severe COVID or to die from COVID, but they're also a very big vector, or in terms of like spreading COVID, they're very fundamental. So I think you mentioned some of the challenges here. You mentioned that you're doing clinical trial. What are some of the things that one you could do as an organization, or what you think other organizations within your space can do to either mitigate some of this, or is it just a policy question? We'll get to some of the policy conversation when you talk to Glenn, but I wanted to just see from what you have, Connie, or what you've seen from different organizations and what your organization is doing. What are some of the next steps, even if you're not going to solve the problem in one sweep?
Yes, I mean, next steps is hard, but you know, I kept thinking about how I'm like an advocate for integration of services, right? That's why I work in HIV and sexual and reproductive health. But I was thinking about how we have or are trying to around like HIV testing, around blood donations. We don't have enough blood. You're like, why don't you integrate at Lancet COVID Center? There should be the National Blood Service trying to get people to donate blood. There should be someone offering HIV testing services because those lines are really, really long. And that's a good chunk of the population. If we are going to try and be testing as many people, then you might as well integrate as much testing and screening of even like chronic conditions in that one outfit, especially because we're barely allowed to travel anyway. So if you already have that client in front of you, then you might as well be getting as much of the testing of conditions outside of COVID as you can. Because the thing is, you're exactly right, COVID is a virus and we're going to learn to live alongside it. It's probably not going to go away, which means all of these other conditions are still things we're going to have to continue thinking about anyways. So whilst we're coming up with all of these strategies around COVID-19, I think it is so critical that we're thinking through how do we integrate them with existing services, with existing testing and screening mechanisms so that we're kind of killing two birds with one stone, especially as Dr. Chirisa said, we're resource limited, right? So we might as well maximize the opportunities that we're creating right now so that we get the most out of it.
Mm-hmm. Right, I think we lost you a bit here and there, but we heard the last bit. So I think the main message is integration. And it sounds like you're an advocate for integration with the organization and you're pushing for that. So we're going to move on to the next. I know you mentioned Dr. Chirisa and Fibion in your discussion. I don't know if Dr. Chirisa and Fibion, do you have anything to add around integration?
Yes.
So maybe just to add on to that, I think integration is really the way to go. Like I spoke earlier, even in diagnostics, previously you would have people buying a TB machine, others buying an HIV machine, but now one machine can be used. Because I think what we need to look at is patient-centered services. When someone walks in, it's not a disease walking in. So if a person walks in, if you can, treat them or screen them for everything that they could potentially have, then let's do that instead of, creating, siloed systems targeted at particular diseases. And obviously that even stretches the little resources that we have if we go that route. So, integration is I think that's the future,
Yeah. Dr. Chirisa?
Yes, I wanted to say that we are actually taking integration in the mental health very seriously. In fact, before COVID cases started to come to Zimbabwe, in early March or February, we actually had a conference with HIV department and TB department at the ministry and with partners where we were actually discussing how we are integrating and merging services, the HIV, TB services with mental health, and we had a robust discussion. Also, if you look in the global funds that are there, there's actually a mental health component, and we are really pushing, and it has actually grown in terms of integration. And we have seen other players on the ground right now actually having started to integrate. Studies are being done in various provinces to look at the rate of anxiety, and we are working with that so that we can produce data which then speaks to policy. But that's really work in progress. Thank you.
Exactly, yeah. So yeah, you cannot manage what you don't measure. So that's very good that you're starting from a data point and then you tell the story going on from there. So we are actually going to pivot into the next section of our conversation. Our initial plan was that we're going to have breakout rooms and have 3 different breakout rooms, but the technology doesn't really allow for that. I think it would be a little harder to manage to be able to do like different breakout rooms. So what we will do is that we're now left with the section where we're going to talk about, okay, so what next? And then we're also going to talk about some very innovative ideas around vaccines. What are the grassroots efforts that we can all take and what can each of us do? We talk about the 3 R's, right? First one is recommendations of what we're going to do. Second one is rationale, why we want to do it. And the third one is roles, who is going to do it, right? So when you think about, if you want to talk about something actionable, at least like the 3 minimum things that you need to have. Of course, there are other details around that, but at least that's where we're trying to get to. But before we go there, I want to just have a quick check-in if there are any questions on this section for Nancy and Constancia. Any questions in the group chat before we? Okay. If there aren't any questions, I think we can move on directly. If there are if other questions come through, we'll come back to both Nancy and Connie. So in this section, we're actually going to focus on how do we get ahead of COVID-19. We've talked about what is the current situation. We're at 20 million globally, 1 million in Africa. I know it's over 500,000 in South Africa and nearing 5,000 in Zimbabwe, right? So those are some of the numbers, right? So we have some time to plan, hopefully, at least, right? Because the numbers in Zimbabwe in particular have not gone up as high, right? One part of that is we might not be testing enough, but another part might also be that population density and all the other factors are in our favor, at least for now. But what we found is that the most vulnerable communities are always going to end up getting the short end of the stick when COVID does hit the whole community. So what we wanted to talk about is, we'll start with vaccines. So Clarity Kaseke is working on vaccines research right now. And what we wanted to just get, I know there are a lot of vaccine questions, so you're going to get a lot of questions soon after your discussion, but I wanted to really hear about what has been your experience in vaccine development? Where are we now? You can talk about the global side or specific work that you are doing in particular. What are the challenges? You know, when can we get one, right? That's what everybody is saying. When can we get one? And will Zimbabwe be on that list, right? So that's what we want to just find out from you, from your work and what you know about the global situation now. What is the vaccine story?
Sorry about that. Yeah. Thank you so much for the opportunity. So I started off working on HIV, and I think in early March, that's when we decided to switch gears to start working on a vaccine for COVID-19 because of the pandemic. So I think I should start by saying that I'm actually really relieved in terms of like how we are approaching this vaccine development, because you can see that by, I think, end of June, we had about over 150 vaccines in the pipeline. And I think that's a great improvement if you look at other viral infections that have struck us in the past, like HIV. We were still working on a vaccine for HIV, but right now we already have 150 vaccines for COVID-19 that are in the pipeline. But that being said, I think because of where we are, especially with the numbers and the infections, it's somewhat a balancing game with the vaccines that we have, because right now I think the US has funded 3 vaccines that are going into phase 3. And so those vaccines have somewhat skipped some stages that you would normally go through if you are developing a vaccine. And so we're talking about like 2 to 6 years of developing a vaccine, but we just don't have that time. And so we skipped certain phases. So we have the Moderna vaccine and Pfizer BioNTech vaccine. And so those are mRNA vaccines. And as of now, we don't have any mRNA vaccine that has been licensed. And so this is something that is very new that, you know, scientists are trying to push forward for COVID-19. And so there are implications that can come with using something that hasn't been used before, and especially at the scale that we'll probably need to use this vaccine. Like we probably have to produce like 1 billion vaccines for the world, because if you're going to achieve herd immunity, then we need to have a lot of those. And so there are implications around that. And then besides that, we also have our traditional vaccines that we're used to, like inactivated vaccines or live attenuated vaccines. But the other thing is that we don't know quite much. Like we know enough about COVID-19 to like have an attenuated vaccine or an inactivated vaccine. But I don't think we also quite understand the pathophysiology of the virus for us to be able to be sure that we can push forward an inactivated vaccine or a live attenuated vaccine. And I think that just complicates the process. But as of now, because of like the strides that we made in like bioinformatics, the structure of SARS-CoV-2 is already available out there. And also like, you know, harnessing the knowledge that we have on the previous SARS and MERS pandemics. So that has been really helpful in vaccine development. But then I guess the other question is, when we are designing these vaccines and when they're being carried out for trials, they're being tried in like, a specific set of people. And right now in Africa, people were not kind of keen on having these vaccines tested in Africa because of historical reasons, right? And I think that is justified because of what has happened previously, but also there's a downside to that because we have many cases like rising right now in South Africa, and it's only a matter of time before those cases start spilling over. And so you would want to have a core of people from Africa, especially in the process of developing a vaccine, so that we kind of have a broader coverage of the different sets of people that will need to be protected once a vaccine is rolled out. So I guess the question of like, when will a vaccine be available? That's an interesting question because we are all trying to push for a vaccine by December 2020. So the US government, as of now, has 3 vaccines, like I said earlier on. The first one is Moderna, which just went into phase 3 and is going to be expedited such that maybe around December 2020, it will be available for approval. So that's true for the Moderna vaccine and also the Pfizer and BioNTech. And then we have another vaccine that is being developed at Oxford. And this has been funded to start like to be developed in production. Like it's already in the development, production and delivery pipeline right now. So like beginning of September, the production of that vaccine will probably begin. But there are major drawbacks to this vaccine because of like safety. It didn't quite demonstrate good safety levels. And so there's a question about that. But again, it's safety versus severe COVID infection, which is why this is still going to be pushed for. So I think by December 2020, we'll probably have something significant in the pipeline. If not, something will probably be rolling out as a vaccine. But I think, again, just like we already have anti-vaxxer movements, people were so against vaccines. I think that is something that we'll have to deal with when we get there. As of now, we're just trying to push forward to have something out there to protect people who are like at high risk of COVID-19. And then we'll deal with the balance game.
Okay, no, that's very thorough. I got a couple of things from that. We're accelerating the process. There's some good news, but also mixed news because we don't know exactly how it works. There's some safety issues potentially, but maybe the horizon December 2020 approvals if things go well. That's a really good good summary. So I wanted to move on to a couple of our panelists. Then we can leave some time out at the end for just question and answer from the audience, because I'm sure a lot of people want to ask some questions here. So Itai, you've been very active in the biomedical research area, but also you have some thoughts around what we can do in terms of grassroots efforts, entrepreneurship, local ideas to be able to push forward solutions for COVID-19. Can you talk to us a little bit more about some of your work and what are some of the more recent successes or activities that you've been doing in this area?
Well, thank you so much, Teach, for the opportunity to talk. I just want to start off by outlining a project that I've been working on. It's really a project that has been fueled by, Zimbabwean students and young professionals who are kind of in the diaspora in the European area, and some of them are actually in Zimbabwe as well. And so right at the beginning of the pandemic, we started seeing that there were a lot of deaths. We had so many people dying in Italy, and even in the UK, we started seeing a lot of deaths as well. And when we recognized and when we noticed that in Zimbabwe, COVID-19 had already started, I think that was the time when Zororo Makamba died. It really struck closer to home. And so as Zimbabweans in the diaspora, we kind of put our heads together and we try to figure out what are some of the solutions that we, even though we are not physically present in Zimbabwe, can invest in so as to help mitigate the spread of the virus in the country. And so after brainstorming a lot of different ideas, we decided that we can come up with a platform that can really help people learn more about the virus and the different ways that they can implement in their own lives to help prevent the disease. And so as a result of that, we decided to launch what became known as the Zimbabwe COVID-19 Support Hub. And this was an online platform in which we're just basically pulling a lot of verified information on COVID-19. We had a collaboration with Harvard University, and we're working with them to kind of translate a lot of infographics that they had. Because one thing that we recognized was that in Zimbabwe, we have like different languages, right? And so we're thinking of different ways that we can get those infographics to different locations. And so we ended up kind of translating the infographics to Shona, Ndebele, Kalanga, Tonga, and we just basically distributed those infographics via our online platforms. And in addition to that, we established kind of Facebook, a Facebook page and Twitter pages as well to just maximize the amount of information that we're getting out there. And this was important for quite a number of reasons. First of all, COVID-19 kind of came at an unexpected time, and there was a lot of kind of panic that resulted. So as a result of the panic, we ended up seeing that in social media, we got a lot of conspiracy theories being distributed. You know, people talking about 5G, people alleging that Africans are somehow immune to COVID-19. And so we're really trying to combat some of those conspiracy theories so as to equip people with helpful information that they could implement in their own lives and help slow down the spread of COVID-19. And I think from that experience, one thing that I learned is that it's very powerful to work with the network that you have. So for example, we were working in the UK outside of Zimbabwe, but we had contacts in Zimbabwe. So we actually ended up working with doctors who were on the ground in Zimbabwe. And we're able to kind of mobilize these doctors to do online live sessions with people via WhatsApp groups. And that was very helpful because, when you are trying to establish a grassroots project, when in actual fact you are not in the country, sometimes you don't really understand what is happening on the ground. Sometimes the solutions that you can come up with may not necessarily be what people on the ground need. So I think having that connection with people back at home was very critical. And so I would urge to all of the listeners who are out there and who are considering how can I help being based in the diaspora, how can I help with any sort of initiatives that can mitigate the spread of COVID-19 in Zimbabwe. I would say it's critical that first of all you collaborate with a lot of people, but have that strong connection with people back at home so as to bring those ideas into fruition.
Yeah, no, very, very good description of grassroots efforts and a mix of both people who are working globally outside of the country and inside the country, because really we need both parts of our communities to be working together in this. Now, I think I wanted to really also emphasize the next conversation because it kind of puts everything together and in context, right? We're talking about vaccines, we're talking about grassroots efforts, but then one of the key things that happen is that this is not happening in a vacuum, right? We have an existing social setup, we have an existing sort of governance and policy system that is in the country, and we wanted to let's explore some of those factors. We have Glenn Mpani, who is an experienced policy partner, and he will walk us through a little bit of what he has seen in terms of the effects of COVID on social policy and governance, and what you see as some of the threats and maybe even some solutions that we can throw out there to be able to make sure that we weather the COVID situation in a holistic manner and not just focus on just health, but also make sure that our context is quite right and when we talk about these issues. We need audio. Oh, we
I
can't.
think Glenn is muted.
You might want to go unmute. Is not muted. But we have a challenge with your audio. Maybe unmute. I think you might have two devices. And while Glenn is figuring out, I just want to say quickly, we're going to get to a quick question and answer session before we end the conversation. But all the resources that have been mentioned here are going to be sent around, or the WhatsApp groups or the online reports from the ministry and so on. We'll collate all of those and then forward them to everyone.
Yeah, while Glenn is also working, I just wanted to say there's a question from Rodney. He has his hand raised, and I will go ahead and allow him to speak really quickly while we wait for Rodney.
Okay.
While we'll wait for Glenn, sorry.
For Glenn, yeah. Glenn, while you get ready, we're just going to field a question.
No, I'm sorry. I actually don't have a question. I was multitasking.
Oh, okay. No worries.
Thank you. No problem. Glenn, are you ready?
Oh, no.
We can't hear you.
Can you hear me?
Yes.
I can hear you now.
Hello, can you hear me now?
Yes, welcome back. Please
can
go
you hear me? Sorry about that. Thank you so much. I think the title of this discussion is very appropriate. I think titling it "Opportunity or Disaster," I think is very apt. I think whenever there's a pandemic in any country, I think we need to understand that, or in any region, it always exposes the governance challenges that are there within a country. It exposes the policy gaps. It opposes the legislative gaps. It also exposes the leadership challenges. And Zimbabwe is not immune to those issues. And I think there are a number of countries globally. So we can't single out and just simply say this is unique to Zimbabwe. I think everything that is underlying within an institution and framework of governance is coming to the fore. And while it's coming to the fore, I like the presentations earlier on that we're talking about lack of capacity in terms of the health systems, lack of resources, and all that. But at the center of it is we need to deal with the issue of leadership and the issue of the policy and legislative environment. And I think one of the things that happened within a pandemic is the declaration of a state of emergency. And once you do declaration of a state of emergency, you then forfeit a number of human rights that are supposed to be enjoyed by citizens. And in addition to that, there are other additional things that come into place in terms of how you are procuring resources, issues of transparency and accountability. The fact that when you suspend certain issues because you want to deal with the pandemic, there are many issues of corruption that we have had globally. And these are happening as a result of the fact that you want to do things speedily, and at the end of the day, individuals exploit that environment. And that's a situation that takes place. The third issue that one needs to be able to deal with is the issue of the legislative environment. How do police deal with maybe issues of curfew that are within a country? How do you even get in resources like the army and the soldiers to be of value? And you'd also notice that in most of our countries, most of the civil society that we've had, which is another additional challenges that come into play, most of their work has been mostly confined to raising issues of human rights issues. You find that a glaring gaps comes in now when you're dealing with a pandemic like this one, because the few organizations that have been dealing with socioeconomic rights, they are now overstretched. The ones who are mostly used to dealing with civil and political liberties, all they can be able to do is to highlight the challenges and the problems. But to go into a solution-oriented approach in terms of what needs to happen, it remains a gap that needs to be dealt with. And I think these are some of the challenges that are being dealt with. And in Southern Africa, you have had many countries where people have taken cases to court. In South Africa, there have been cases that have been taken to the court. In Malawi, you have had injunctions that have come in where the government has been stopped from imposing the lockdown. The same issues have happened in Zambia and in Botswana. So that reality starts playing out at the end of the day because people are demanding to simply say, while they're dealing with the pandemic, how about the governance issues? And then the next issue that we need to deal with is to say, where are the opportunities? I think the weaknesses that are being exposed during this environment push us to a position where we need to be able to reflect. I would want to hear more from the opposition, from civil society, a more solution-oriented approach. I don't want to hear more about the weaknesses. I want to hear of the solutions to say, you are doing this in terms of pre-testing, in terms of how you're dealing with problems. What is the solution? You identify the governance problems, identify a solution. You're identifying abuses of resources, identify a solution, put a framework. Because we have got a pandemic that is evolving, it is not useful to only identify problems. So we need to be able to have solutions to deal with it. The other issue that is very important, which is also an indictment on most of our governments, is that they need to listen. They need to listen and stop politicizing everything that is to do with, this is a reality, people are dying. So it doesn't help to be managing numbers, neither does it help to create false confidence, neither does it also help to take advantage of restrictions to manage a political problem. So this is what governments need to be able to deal with. And lastly, in terms of my contribution, is that the reality is with the pandemic, some governments will exit power because of the pandemic, because the frustration of people is heightened. You are affecting people's livelihoods by telling them to stay at home. They are not able to get by on a day-to-day basis. So the reality of it is that governments get unpopular, people get frustrated, more weaknesses are exposed. So these are some of the governance challenges that I've just summed up in things that need to be dealt with if we are to deal with the governance problems. Yeah.
If that's okay, I'm going to add one really quick question for you, Glenn, from Lisa. And it says, I have a question from Ms. Tampani. I worry that with regards to education in Zimbabwe, we're experiencing a real divide between the rich and the poor. And the policy from the ministry around opening government schools has been based on fear. And I feel we need to be thinking outside the box in terms of how to reopen schools, especially primary schools. I wonder if there are any thoughts on that. And she also says, in the same way that corporations elsewhere change their production line, our police and army could be helping on the ground.
And if you can keep it to a minute and a half or so.
Right. Thank you so much on your question. The issue of opening up schools is very important. But at the end of the day, if you don't have adequate PPE, if you don't have adequate resources to protect the students, particularly with our infrastructure in the education system, which has been affected. So the option for the government in a situation like this is to say people should stay at home. If we are to talk about online learning, I think we know our infrastructure in the country. Resources, people are struggling. And my opinion has been to basically say it's better for schools to remain closed in the interim until we have gone past this wave of COVID. Then we can be able to open up rather than us experimenting with a situation where we know that our infrastructure is not conducive enough.
Thank you for a quick description. So I'm noticing we are actually going up against time. What we will do, I know we started about 5 minutes a little later, so we will continue to go on for just 5 more minutes if you will be with us to, what we want to do now is just to have a round robin of questions for the latest panelists, and I will get us started. So we're going to go just a few minutes over, and then we'll stop the recording in about five or so minutes. So one question on vaccines, I think it was also from Lisa here, who's a public health practitioner based in Manicaland. And she says, I do worry that the push for getting the vaccine has gone against standard research protocol, and that there's too much of a focus on vaccine as a cure-all when the efficacy will not be that great. Any thoughts on that?
Yeah, so I'll take that on. So I think right now with where we are at with the infections, like we have like a high number of infections and a high number of like deaths. And you have many people who are susceptible to COVID-19. And so you have to make a choice and be able to protect the people who are susceptible to the infection because like currently you're weighing, so some of the adverse effects, for instance, for the Oxford vaccine included severe headaches and things like that. So you're weighing those against being hooked on a respirator. And so that is where we are at. And I think we have to push for a vaccine so that we can protect the people who are really susceptible to the infection. But also, that vaccine, once it comes out, it's still going to be, we're still going to improve upon it. For instance, I'm working specifically on a T-cell vaccine for COVID-19, and that's probably going to take us 2 years from now for that vaccine to be out there. And we will still like work on a vaccine and like continue to improve upon what we have, because right now what we don't have is time. So we need a working solution. So we're just going to work with what we have and improve upon it as we go, so that we can achieve that herd immunity, because COVID-19 also has, it could potentially become a seasonal infection, and that's something that we need to prevent. So talking about like the effects versus what we have seen so far versus the deaths that we've seen so far in people who are susceptible to the infection, I think it's rational that we push for the vaccine to protect those people as of now. So yeah.
Thank you so much for that answer. And one of the things that I wanted to do was get a question also from around the grassroots activities for Itai. I don't see any questions in the chat on grassroots activity. If there are some, just bring them to my attention. But
yes,
there are some.
Yeah. Yeah, there's one from Jackie Nyamatumbo, and it says, what are some economic opportunities that could arise from this COVID period? What ways could Zimbabweans engage in the tech space, and what are tech needs that could be met by an average Zimbabwean with a computer and coding experience? And she goes on, it's kind of long, but she also says, what other needs could we self-sustain, like PPE, food delivery service, etc., and how can we engage this largely unemployed workforce in Zimbabwe and use COVID as an opportunity to innovate?
Thank you so much for that. It's quite a loaded question. I think just to kind of like start off in terms of like the opportunities, I would use some of the things that I have seen being adopted in other countries. You know, when COVID-19 started, as you might be aware, you know, people were being kind of like encouraged to work from home. But this would only work if you are living in a country that has the capacity to give you, you know, to have that capacity to actually work from home. But in the context of Zimbabwe, we know that like a lot of people are involved in kind of the more informal sector. And I think, you know, the issue of the jobs that are available in Zimbabwe, it's kind of a more systematic issue. So it's an issue that really requires a lot of engagement from the government. It requires a lot of engagement from like, you know, different corporates. It requires engagement from investors as well. So I think, you know, as a nation, it's very important for us to look at, you know, how other countries have kind of combated this issue with COVID-19 and the livelihoods of citizens, and kind of learn from those countries in order to adopt some of the technologies that they have. I mean, generally, I do think that, you know, some of these technologies can be easily adopted in Zimbabwe. The only thing that we lack is, you know, kind of the resources as well as support from the individuals that have the capacity to introduce some of these technologies.
Yeah, thank you so much, Itai. I want, out of respect for all our guests and audience and all our time, I see we're running up around on time, but I would just give, throw out an open, is there anything that one of the panelists would like to address that has not been maybe asked or answered, you know, particularly well? Any parting thoughts around the area that you've spoken on before we go into the final stages of this webinar?
Yes, I have something to share. So it's connected to some of the points that Clarity made around the vaccine and the need for it to be tested also in Africa. And yes, of course, there's the background and context and then of people being apprehensive about this, right? But I just wanted to, well, first off, I am a proponent of the vaccine also being tested on all of us as well in Africa. And the reason is that my experiences working in healthcare has been, we've been left behind before, right? And it has had a huge impact. So I started my career in cancer research, and I specifically worked in a lab where we studied breast cancer in women of African ancestry. And the phenomenon was that you had all these therapies developed and, you know, but Black women showed up globally, by the way, African diaspora, wherever, showed up and still died. They didn't recover. Their survival rate was the lowest. It was like, oh, what did we do wrong? Well, you never actually studied what their subtype of breast cancer was, or many reasons why this was never done. But I call this concept kind of inclusive innovation, and I have conversations about it all the time in my work. As we develop AI, for instance, are we making sure that it's going to also know how to detect cancer in other populations, not just like the ones you are testing on with your big databases from Sweden, right? Or something like that. And that's why this vaccine also needs to be, we need to be taken into account with it. And we also need to have, I think the big thing is like everything being done ethically, right? And representation of Africa at the table being there. That's at the important points at this time. But yeah, it should come to us as well.
Thank you for that summary. That's really goes to the core of this idea, like who is the opportunity for, and how do we make sure that the right people are in the right rooms when we have these discussions. One of the reasons that I'm very excited to have everybody on the call today, because I know everybody has a vested interest in Southern Africa, in Zimbabwe. A lot of us are working on work just on the ground in Zimbabwe. So it's been a great pleasure to have all of the panelists on here. It's been really good. I think one of the things that we wanted to do was to be able to inform people and also come up with what we think are different opinions, right? And different recommendations. What we'll do after this is we'll comb through the video, come up with some of the areas where we think we were actually coalescing on specific points, and then send out a report on what has been discussed today, what we think are the most important points. And that should be sent to everybody in the next couple of days. I also wanted to just share as a final big thank you to all the panelists that you see on your screens right now. Thank you to Itai, to Glenn, to Nancy, Fabian, Clarity, Connie, and Dr. Chirisa as well. And I also wanted to do a special thank you to the panelists and discussion leads, as well as Education Matters in the use of community at large and network that we've used to spread the word and have this very fruitful discussion, really. And the Minister of Health, really big thank you to Dr. Teresa for coming through. I worked with the Minister, I used to work with the Minister of Health before in my work, and a lot of people behind the scenes that have managed to make this happen. You know, I contacted people who wants to come and talk, and this has been a really good sort of coming together of the community. Hopefully we can use this network going forward to do something amazing and actually make some really solid recommendations. Thank you to all the audience, to the participants. This is really good, great questions that you sent. We didn't get to all of them. A lot of them were really exciting questions. It really just says this is not a one-day issue, right? We are going to continue to have to address some of these ideas and questions. So we'll send those to you and answer the ones that we can. Last but not least, thank you to the organizers. Farah has been working really hard on all the, the technology, the ideas. Tafazo Mugue in absentia, because he was actually very critical in kind of developing the concepts around this, and Constancia, of course, for all the ideas around the concept as well. If I left you out, I'm sorry for leaving you out. We'll definitely send out all the information that we've been discussing today. And at this point, we will end our recording. If you are so inclined to remain behind and ask some questions, if some panelists are available, that is okay as well, but our recording and official webinar ends here. Thank you very much.